I'm an associate professor in the Institute of Gerontology, and then I'm also a board-certified clinical neuropsychologist in the Care Center. So I have multiple roles here, including seeing our patients for neuropsychological evaluations, teaching and mentoring students, and of course conducting research. Yeah, so becoming a clinical neuropsychologist, you first have to get a degree in clinical psychology. So I got a PhD from University of South Florida. You do a year-long residency of full-time clinical work, and I did that at the Miami VA. And then you do a 2-year postdoctoral fellowship, which I did in Central Texas at Baylor Scott and White Health. I then got my first faculty position at the University of Missouri, where I was an assistant professor for 4 years, and then came here to the Care Center and got the promotion to associate professor. Yeah, you get taken to interesting places that you never thought you would be as when you're pursuing that type of degree, because you got to go through a lot of different training, so move all over. Yeah, I've been interested in the Care Center for a little while because I got to know Janae and Lisa a little bit through other routes and was really impressed by the work that they were doing, and the Care mission, which is bring services to medically underserved communities in Georgia. And I got invested in this work during my grad training when both of my grandfathers developed dementia and my grandmothers became care partners to them. And I saw the struggles that they went through. So to have an organization that's trying to help people like my grandparents going through a really difficult time is a good fit for me. It really depends on the day, but I would say my week is divided into days where I'm teaching or seeing patients or doing research. So my patient days, it's get here early and meet with a student who's in training to learn how to become a neuropsychologist. We'll see a patient, do an interview with them. They'll go through some testing, typically with our trainees, and then if we're able to, we can give them results that same day. So our patients are coming to see whether they have cognitive impairment or dementia, and we're able to help them answer some of those questions. On the other days, it looks more like a typical faculty role, meeting with students, developing research projects, and writing grants and papers. Yeah, I have 2 basic areas of research. One is in early detection of cognitive declines associated with Alzheimer's disease, using neuropsychological tests and telehealth methods. And then once we are able to identify that someone is having some cognitive decline, we work on using everyday technology. So for example, using digital calendars to keep track of their appointments, or setting notifications to remember medications, things like that. And my specific area of research is not so much on the development of the technologies, but on how do we train people to use stuff that's already in their environment. Because the best and brightest minds have already developed smartphones and things that we can use for these things, but we find that older adults and care partners often don't have training in these things, familiarity, and they're just overwhelmed with other stuff in their life. So can we develop intervention programs that help them leverage stuff they might already have in their pockets or cars or homes? I think what I really like to see is the integration of the research that we do into clinical practice. So I've been fortunate to be engaged in some research studies that are being implemented in clinical guidelines for the assessment of cognitive impairment in older adults, for example. So to see that the work that you're doing is actually going to inform the practice of other people and making life better, not just for the patients that you're seeing, but having that broader impact is what's been rewarding for me.